CMA-AAMA Certification Exam Review Course. Let's get started. In scheduling, double booking means: is it A, follow-up only? Or B, canceling appointments? Could it be C, 2 patients at same time slot? Or lastly D, booking twice for 1 patient? The correct answer is C. Here is why. 2 patients at same time slot C is correct. This is a scheduling practice, sometimes used to maximize efficiency, which can risk delays and reduced patient-provider time if not managed carefully. Next question. The abbreviation VID means: is it A, once a day? Or B, twice a day? Could it be C, 3 times a day? Or lastly D, every other day? The correct answer is B. Here is why. Twice a day, B, is correct. BID stands for bis in die Latin. Once a day, A, is QD. 3 times a day, C, is TID, turn die. Every other day, D, is QOD, quoque altera die. Next question. A 48-year-old patient with hypertension reports feeling lightheaded when getting out of bed. The MA records BP sitting at 142/88 mmHg and standing at 118/72 mmHg after 1 minute. This postural drop suggests orthostatic hypotension. The best next step is to: is it A, advise doubling fluid intake and recheck next visit? Or B, notify the provider promptly and document the orthostatic changes? Could it be C, ignore if asymptomatic and proceed? Or lastly D, have patient lie down for 30 minutes then retest only? The correct answer is B. Here is why. Notify the provider promptly and document the orthostatic changes. B is correct. A drop of greater than 20 millimeters of mercury systolic or greater than 10 millimeters of mercury diastolic is clinically significant orthostatic hypotension, which can indicate dehydration, medication side effects, or other issues requiring provider evaluation. Advising fluid changes, A, without provider input is outside the MA's scope. Ignoring symptoms, C, is unsafe and neglectful. Having the patient lie down and retest, D, delays reporting a potentially serious finding to the provider. Next question. A patient scheduled for fasting blood work admits to eating toast 2 hours ago. The MA explains fasting is required for accurate glucose/lipids. The appropriate action is: is it A, draw anyway and label non-fasting? Or B, reschedule for a true fasting state and educate on prep? Could it be C, do glucose only? Or lastly D, override and note in chart? The correct answer is B. Here is why. Reschedule for a true fasting state and educate on prep. B is correct. Fasting is critical for accurate glucose and lipid panel results. Drawing non-fasting samples, A, can lead to inaccurate results and inappropriate clinical decisions. Performing only glucose, C, ignores the lipid panel requirements. Overriding, D, disregards standard protocols and compromises test validity. Next question. For a dehydrated toddler needing a heel stick for labs, the MA warms the foot, chooses the lateral plantar heel, wipes first drop, and collects gently. This follows proper. Is it A, capillary collection technique to reduce pain/hemolysis? Or B, venipuncture guidelines? Could it be C, arterial sampling? Or lastly D, no warming needed? The correct answer is A. Here is why. Capillary collection technique to reduce pain/hemolysis, A, is correct. Warming increases blood flow. The lateral plantar heel is the safe site to avoid bone and nerve damage. Wiping the first drop removes tissue fluid, and gentle collection prevents hemolysis and excess squeezing. This is not venipuncture, B, or arterial sampling, C. Warming, D, is a standard step to improve blood flow. Next question. Chart shows severe penicillin allergy, but provider ordered amoxicillin. The MA should. Is it A, give it with monitoring? Or B, hold and alert provider for alternative? Could it be C, ask patient if allergy still exists? Or lastly D, proceed as ordered? The correct answer is B. Here is why. Hold and alert provider for alternative B is correct. Amoxicillin is a penicillin derivative and is contraindicated in patients with a severe penicillin allergy due to risk of life-threatening cross-reactivity. The MA must question the order before administration. Giving it A could cause anaphylaxis. While verifying allergy status C is part of the process, the critical action is to hold the medication and alert the provider. Proceeding as ordered D violates patient safety protocols. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe and tell me what topic I should cover next. Bye.